Hello, Colorado, and thank you for joining us today. First, a brief update on COVID-19 in Colorado. Today, 1,511 cases. That's subject to be updated by 4. We have 833 people hospitalized. That number has been relatively stable at that level for the last few weeks, ranging between 8 and 900. And remember, it wasn't that long ago in early December when we were at 15, 1,600 and really worried about our hospital capacity. We hope that and wish well for everyone who has a loved one in the hospital with COVID-19 that they recover, and many will. We also extend our condolences to those who have not recovered. We've lost 4,281 Coloradans to this deadly virus, and my heart goes out to the families and friends of each and every one. Today, we're going to be talking about vaccine distribution, how you get the vaccine, if you're 70 and up, where you sign up. We have several of our partners, some of our larger partners and our partners in equity for vaccine distribution with us today. We have Peter Benko, the CEO of Centura Health. We have Dr. Richard Zane, UCHealth's Chief Innovation Officer, and John Santisteban, the President and CEO of Salud Family Health Centers. These are just 3 examples. We have many partners across the state. But these 3, Centura, UCHealth, Salud, have been key partners in our efforts to get vaccines into the arms of those who are at greatest risk. And they're going to provide, sort of lift up that kimono to show you how they're working to quickly vaccinate every Coloradan age 70 and over, which we expect to accomplish by the end of February. Everybody over 70 who wants it by the end of February, potentially sooner if we get more supply, and we'll talk about that. We only are able to administer the vaccine that we get, and with current quantities, it's likely to take us all the way through February to get everybody age 70 and up who wants it. I also want to take a moment to thank all of our providers and partners in vaccine distribution and their staff for their incredible work, not only going above and beyond, putting in long hours, but now really helping to undertake one of the biggest vaccination efforts in a century, an enormous endeavor. These are 3 great representatives of institutions that are stepping up. There are dozens of others across the state, and you're going to hear about some of the issues that they face every day. And also, we want to make sure if you're over 70 or you have a loved one, a parent, a friend over 70, you know how to sign up in an area that's close to you for the vaccine. Really, our partners on this call today and our other partners are a big reason that Colorado is among the very top tier of states when it comes to vaccine distribution and starting that protection clock. Now, call it starting the protection clock because that's what the first vaccination does. Then 3 to 4 weeks later, a second vaccination, and then another week or 2, and then that level of 95% is established. And during that intermediate period between the first and second shot, the data shows there might be some enhanced immunity, but not the 95%. It might be 60% or 50% or 70%. There's increased, but you are still susceptible to the virus at a slightly reduced level until that second vaccine kicks in, the booster, and then a week or 2 later. Last week, we were excited to see our very own Lieutenant Governor of Colorado, Diane Primavera, who is part of the 70 and up population, receive her vaccine. And I know that the biggest joy I get every day is reading our posts on Facebook and Twitter and saying, I'm 72, I got the shot, or my mom's 86 and she got the vaccine. You don't know the joy that brings me. And of course, it brings to their family members as well, knowing that soon they'll be able to socialize and join their loved ones in a safe way. Our main goal is to vaccinate 70% of Coloradans 70 and up by February 28th, and we intend to do that. Diane Primavera got her first dose at UCHealth, and really focusing on 70 and up is there's the reason for that is 78% of our deaths are people aged 78 and up, and about 40% of our hospitalizations. So once we have folks protected over 70, we will see a significant reduction in the fatalities and in the hospitalization rate. Now, tragically, this virus can be deadly for people of any age. And we've lost a few people in their 20s and 30s and 40s, and more in that age group have to be hospitalized and do make it out successfully. This is not a good virus to get at any age, but we can make a substantial impact in saving lives when we complete the vaccination and protection of those that are 70 and up. With each allocation of the vaccines that we get, we work with several different kinds of partners to get it into the arms of those who need protection. Right now, about half goes out through hospitals. You're hearing from two of our largest and most successful and high quality hospitals today, Centura and UCHealth. 20% go out through community health clinics, and you're going to be hearing from one today, Salud. That's an example of a community health clinic serving our medically underserved, those who are uninsured, those who lack proper documentation, those who don't have another way of paying for their medical services. 20% through community partners like local public health agencies, sheriffs and fire departments. The work in Pueblo is in conjunction with the sheriffs and the police. The work in San Luis Valley was in conjunction with the fighters there. So 20% community partners, usually through local health departments, and then 10% retail pharmacies. That also includes the work at assisted living and nursing homes, which is under a federal contract with CVS and Walgreens. And increasingly over time, us having dosage available through other pharmacies in the state that have their own scheduling systems. But right now, we're expecting for the next few weeks that will be at about 10%. This sort of multi-tiered approach is really to ensure that we are distributing vaccines equitably. If you're 70 and up, whether you're uninsured and live in the San Luis Valley, whether you're wealthy and insured and live in Aspen or Boulder, whether you live in a multi-generational household in Westminster, you should have no barriers to getting the vaccine if you're 70 and up. Now, the frustrating thing is that there's not enough vaccine to do it this week, to give everybody 70 and up a vaccine. We get about 70,000 a week. There's 530,000 people in our state over 70. So you do the math, and assuming most people want it, and obviously particularly people over 70 do want it because they know that the threat of the virus, it'll take us till the end of February at current supply levels. So that can be frustrating. You say, I want it now. Well, sorry, your appointment's in 3 weeks. Not everybody can possibly have that appointment in a week. We could scale that up and do it from an operational perspective, but we don't have the vaccine. We get 70,000 a week is what our model shows. Now, there is upside in that might transpire. I want to give hope that we might beat that February 20th date if one of several things happens. If, for instance, they release all the vaccine that's currently held federally to the states to administer. If there's another vaccine approved like Johnson & Johnson or AstraZeneca, if the Moderna dose is allowed to be split in half, allowing 22 instead of 11 doses from a vial. So there's a number of ifs. But right now, all we can count on is about 70,000 vaccines a week being distributed to Colorado. We will get each and every one of those into the arm of somebody who is at the highest risk of dying or being hospitalized from COVID-19 in our state, working with our partners. And that's before we can distribute the vaccine, we have to know what we're getting. And we've created the infrastructure to ensure that vaccines we receive are put into arms as quickly as possible. I'm going to provide a little bit of further clarity on how we even get the vaccines. Operation Warp Speed notifies us the exact number of vaccines we're going to get the following week. So usually on a Thursday or Friday, they will say next week you will get X amount. We may even receive a notice on Sunday of the exact number of vaccines that we will be delivered later in the week. This week for Colorado, our state allocation was 39,780 doses of Pfizer and 36,300 doses of Moderna. Now, however, 23,400 of those doses of Pfizer are going to long-term care facilities through CVS and Walgreens that's managed by the federal government under contract. So the state's net allocation of vaccine for this week is about 16,380 doses of Pfizer and 36,300 doses of Moderna. Now, that won't track up exactly to what the federal government tells us they're sending us, because we count every, we boost every Moderna from 10 to 11 doses and every Pfizer from 5 to 6 doses, because we want, and in most cases, when measured with precision, that is the quantity that will be able to be administered. The federal government models it based on 5 and 10. We model it based on 11 for Moderna and 6 doses for Pfizer. And the reality is close to that when measured with precision. So if we can recognize 10.8 doses for Moderna and 5.9 for Pfizer, we're well on our way to getting that boost. So in working with our providers, and they can give clinical examples of this, but generally speaking, they're able to recognize that extra dose from each bottle, and we know that they're expected to do that, and they do their best to do that. So knowing what we know and when we get it, we only get a few days to determine each week which providers the vaccines go to and how many each provider receives. So we're currently expecting about 70,000 a week. Could go up, could go down, but that includes the doses that go to long-term care facilities. And we're excited that next week, we've been told that we will get an additional shipment of 23,400 doses. That includes the 6th dose of the Pfizer vaccine to support our vaccination efforts. So we're very excited about what we believe to be a temporary boost next week. And the reason we're receiving that is because the long-term care facility program is behind on administering doses, and Operation Warp Speed is holding their allocation until they've caught up and freeing us up to be able to use some of those vaccines that were scheduled for people age 70 and up through our partners and our providers. We continue to advocate for the federal program to accelerate vaccinations for nursing homes, long-term care facilities. That is the only piece that is not under state coordination and state management. It's under a federal contract, but we have offered Walgreens, CVS, the facilities themselves, state support to accelerate their schedule. Overall, the federal program means that the number of doses that can be used to vaccinate Coloradans can change any given week, depending on the allocation to long-term care facilities. Unfortunately, we only have one more allocation of 23,400 doses that needs to be reserved for long-term care facilities, after which every person who works in one and lives in one will have been vaccinated. And then our state focus will shift entirely to members of the general population age 70 and up, and further expansions of eligibility as we make progress. But there's 530,000 people age 70 and up, and most, and hopefully all of them, want the vaccine. So that's why that is the priority for now. So the challenge that we face is week by week, we don't know exactly how many doses we receive, making it difficult to plan more than a week in advance. And that's frustrating for UCHealth and Centura and Salud and all of our other partners. It would be wonderful to have a 2-week leeway or a 10-day leeway so that we can scale that up. But our priority in Colorado has always been to make sure that vaccines are not sitting on shelves. And thanks to our providers across the state for stepping up, for moving quickly to administer doses. But we need more supply from the federal government to continue vaccinating at this pace and to increase capacity. We had a day last week where we administered 27,000 doses in Colorado in one day. So that would be the equivalent of 140,000 a week. We're only getting 70,000 a week. So we could, even at current levels, and that's even beyond that, even at current levels, we could administer more if we had more. We remain hopeful that the new administration will be sending more doses to the state to administer. We know that President-elect Biden has a goal of 100 million doses, 100 days. We hope that they can reach that or get as close to it as possible. That would contemplate, the only way that we see that number being reached is additional approvals, namely Johnson & Johnson, which, by the way, is a one-shot course instead of 2. And then potentially additional Moderna or Pfizer, and then whether AstraZeneca makes it into that mix or not is another question. The providers joining us today have worked hard, really, and I've had conversations with all of them, and I was just so proud to see them step up for Colorado to increase their capacity to administer the vaccine to their patients, some of them vaccinating thousands of people per day, but also opening that up to people that they don't have a relationship with and that are not currently UCHealth or Centura or Salud patients. And we're very, very proud of that. UCHealth, as Dr. Zink will talk about, already is accepting people that are not, haven't been their patients on the UCHealth portal to sign up. Centura will have that up and going within a few days. Salud is serving both their patients and non-patients. They're able to contact their patients much easier, right? So they know who's ever been to a Centura hospital or Salud clinic or UCHealth who's 70 and up. And that's a lot of people, by the way. We actually think the majority of 70-year-olds and up have had some interaction with the hospital system, however routine, in the last several years. But we also want to make sure that those that have not had any contact with the hospital system, because they fortunately had their health and not needed it are not at a disadvantage in this process. So with that, I want to turn it over to one of our premier partners, Peter Benko, the CEO of Centura Health, to tell us about their efforts to help protect people who are 70 and up from COVID-19 and the pandemic. Peter?
Thank you, Governor Polis. Thank you for your leadership, your partnership, your listening, your clarity and direction, and for inviting me here today. I'm truly privileged to lead Centura Health, which is a ministry that was started in the 1880s, and now we have grown to over 15 hospitals in Colorado. I'm also privileged. My job as CEO and my only job is to support those that serve. And those are our 21,000 caregivers that have run to every challenge in our flourishing communities. And as everybody knows, we've had our share of challenges throughout this. Vaccinating millions is new to all of us. Especially in a country that is woefully underinvested in public health over the last several decades. So I'm excited to share some of the details about the work we've been doing internally and with the 70+ population. You can see the slide. I'd like to introduce you to Emmanuel. Emmanuel is one of our caregivers. He's an immigrant from the Democratic Republic of Congo. He and I have spent a lot of time because my daughter and I had the opportunity to visit the border of his country as they border Rwanda a couple years ago. He speaks 6 languages. He filmed himself delivering the message on why he was receiving the vaccine in 3 of the languages that he speaks. And his message is very important, as you'll see in a few seconds as I share our internal data. So starting on December 16th, we started to administer vaccines to the Tier 1A and then eventually to the Tier 1B healthcare workers. I received my vaccination on Friday. We've administered 25,736 doses internally. 98% of those that have received the first dose have already scheduled their second vaccine. That represents 60% of our healthcare workers have been vaccinated. We did a survey right before this where we got feedback that about 66% of our healthcare workers anticipated getting the safe and effective vaccine. 92% of our physicians have chosen to be vaccinated. We have higher vaccination rates amongst our physicians, advanced practice providers, nurses, and those in clinical leadership positions. Unfortunately, we have lower vaccination rates amongst our healthcare workers in all communities of color. Black African American caregivers are 44% less likely to receive the vaccine. Hispanic, Latinx caregivers are 22% less likely to receive the vaccine. Our internal numbers mirror those nationally and across many states. We believe our history of systemic issues in the medical community, as well as current stories of misinformation, disinformation, myths, and conspiracy theories, are fueling continued mistrust and building barriers to individuals wanting to get the COVID-19 vaccine. We partnered with the state in November and December and took it upon ourselves to develop public service announcements around similar issues, encouraging masking, social distancing, and washing your hands. We're going to, in the next few days, launch a similar second independent public service campaign around the importance of vaccination, especially in communities of color. So for the next several weeks, if we could go to the next slide, for the next several weeks and throughout the month of February, as the governor talked about, our focus here at Centura for vaccination distribution and administration will be encouraging those connected with, those healthcare workers that are employed, aligned, and affiliated with Centura to get the vaccine, as well as a hyper focused on the 70+ population. My mother, who's in her 70s, I won't give her exact age, asked me last week, is it safe and effective? She's still working in a school system, and I told her to schedule that. Unfortunately, in the state she works in, she has to go to a football stadium to get it done. And she's not exactly comfortable around being around a couple hundred people, and she'd prefer to have it in a more intimate setting. So I'll talk about what we're doing to make sure that that happens. So starting this week, we're able to administer at Centura vaccines to 9,360 individuals. In 2 weeks, we'll be scaling up and have the ability to accommodate 14,142. 2 weeks after that, 16,608. And at our peak starting February 24th, and for the foreseeable future, we'll be able to vaccinate 22,818 people a week. Like our colleagues, health systems at UCHealth and others, we're ready. We can scale. As the governor talked about, the limiting factor right now is the supply chain of vaccines coming into the system. But please know that Centura Health and all of our colleague health systems are prepared to support you. We have stood up 35 vaccine clinics across the state of Colorado in our community-based clinics and in our hospitals, so you don't have to line up with hundreds. You can get it in a small setting where you can be safe. Our expanded vaccine capabilities required us to invest and hire more than 350 additional people in our workforce. So this is an important endeavor. So we've got to check people in, we've got to draw the vaccine, we've got to administer the vaccine, we've got to document the vaccine, we check you out, we roam and observe you to make sure you're okay to go home. We have added security and we've got information technology to support it. So this week alone, we've extended 7,500 invitations just in the past 24 hours to patients aged 70 and older based on our vaccine allocation this week. We are starting with individuals 70 plus who have an active My Centura Health account, and that's over 275,000 individuals that are 70 and older. So as the governor said, that doesn't truly cover everybody. So we're continuing to work on our plans to both make the vaccine available to members of our community through our website, and you can refer to that there, centurahealth.org/COVID-19 for resources, as well as a call center and other mechanisms for those individuals that don't have access to telephones or the internet. Our incredible 21,000 people are always on a mission and feel called to build whole person care and flourishing communities, and to partner with the governor, the state, local communities, our colleague health systems, and every resident of Colorado to eradicate this virus. Thank you, Governor.
Thank you, and we're and we're thrilled, Peter, that within a few days you'll be able to accept signups from the general public too. But to put things in perspective, it sounds like more than about half of the people age 70 and up are already in your system in the state, and that's because most people age 70 and up have had some contact with a hospital at some point. And it could have been a knee replacement, it could have been pneumonia 6 years ago, whatever it was. Many people have. For those who haven't, that's why the public portal is so important. UCHealth already has theirs up. Centura will soon. Salud also serves, and all the community health clinics, a subset of people that might not have had interactions with Centura or UCHealth. So these are all together. These really form a way to reach everybody. Of course, the frustrating thing for anybody's grandmother, mother, or yourself, if you're over 70, is not everybody can get it this week, and not everybody can get it next week, because we only get the 70,000 a week. Dr. Zane.
Morning, thank you. And congratulations, Governor, and congratulations, Coloradans, because Colorado has done a remarkable job with COVID. It's really almost impossible for me to believe that a year ago or so, I took care of my first patient with COVID, and it's not something I will ever forget. It's also just remarkable and scientifically incredible that we have a vaccine almost a year later. Defies all scientific probability. It's probably the single most important scientific and medical achievement of our generation, and we are beyond proud to participate in vaccinating Colorado. I know that everybody is anxious to be vaccinated, and to concur with Mr. Banco and Governor Polis, we are prepared to vaccinate Colorado, and we are limited by the supply of vaccine, but our guiding principle is not one molecule of vaccine will be wasted, and we do have no interest in having vaccine sit on a shelf. 3.5 or so weeks ago, we received our first supply of vaccine and started vaccinating within 2 hours of that vaccine being delivered. As of this morning, we've vaccinated almost 55,000 Coloradans, 38,000 first doses, 14,000 second doses. And now we're focusing on seniors over the age of 70. And as of today, we've vaccinated more than 12,000 seniors over the age of 70. I know that people want to know the logistics of how to get vaccinated. As the governor mentioned, if you are a patient of UCHealth, you will automatically get an invitation in a randomized fashion to schedule a vaccine appointment. If you are not a patient of UCHealth, you can go to UCHealth.org and push the COVID-19 button and register for vaccination. And if you are over 70 and in the state of Colorado, we will randomize you to begin vaccinating. And just today or last night, we sent out over 600 invitations to seniors over the age of 70 who were not previously UCHealth patients. We have stood up 11 clinics across Colorado for vaccination, and currently today have the capacity to deliver 5,000 vaccines per day or 35,000 per week. So we can do that today. We also have stood up 3 pop-up clinics, partnering with partners such as Salud to bring vaccine to these communities, because it is so very important to think about equity and delivery of vaccine, but also to bring the vaccine to communities, knowing that some communities don't have access to cars, transportation, and maybe even the internet. In the next few days, we're going to stand up a call-in line for those that don't have access to a computer or the internet, where you can call, get information, register by phone, and then we can communicate with you by phone when there's an appointment for you to get vaccinated. Partnering with the state of Colorado, by the end of the month, we are going to stand up a very large drive-through mass vaccination clinic in Denver. We hope to be able to do over 10,000 in one single day. So we are very proud to be able to partner with Colorado. We're very proud to be able to partner with Salud and other federally qualified health centers, bring this vaccine to you and get Colorado vaccinated and really put this in our rearview mirror. So I just want to close by saying congratulations, Governor Polis, congratulations, Colorado. You have done a remarkable job. And I know everybody's anxious. We're going to get everybody vaccinated. Continue to wear your mask, physical distance, wash your hands. That all still works. And by summer, hopefully we're all past this. Thank you very much.
And Dr. Zane, I also want to congratulate the UCHealth system on being the first major system to have signups from the general public and your non-customers and randomizing those. So thank you for that overall commitment to the health and welfare of all Coloradans. And of course, being able to also segment your own customers to reach out to people 70 and up. So thank you to UCHealth. I'm now pleased to turn it over to Salud. I mentioned earlier that our community health clinic partners and community partners are a key part of the distribution plan. In fact, they have a mission of serving the traditionally medically underserved. And about 20% of our allocation each week is through community partners like Salud, part of our efforts to ensure equity in the distribution of the vaccine. In fact, the customers that Salud has are more likely to live in multi-generational households or be part of the workforce into their 70s than the public at large. So they have several additional risk categories, which is why offering them protection is so important. Salud Family Health Center is one such premier partner. They're working to help administer the vaccine in hard-to-reach communities, immigrant communities, the Coloradans who don't have a medical home. And I'm very pleased to turn it over to John Santesteban, President and CEO of Salud Family Health Centers. John?
Thank you, Governor, and thank you for inviting me today here to not only represent Salud, but to represent all the community health centers in the state of Colorado. I won't go into a lot of background about community health centers. The governor has already given you a good indication of what we do. What I would like to say about community health centers is there's 21 organizations like Salud across the state, and we're about in every community in the state. And so it's a very large network with the mission of serving the underserved. So I know all my colleagues at the community health centers are all stepping up, as Salud is, to vaccinate as many individuals as we can in the communities we serve. Up on the screen, you'll just see a map of a Salud service area. So we do run 13 sites in 10 different communities. And we are offering vaccinations in all 10 of those communities at this point in time. Up to date, we have vaccinated about 4,480 individuals, and our capacity keeps ramping up of how many we can do today on a daily basis. So we're about up to 1,200 individuals we can vaccinate per day throughout our system. And again, naturally, as you've heard, that's based on the supply of vaccine that is available to Salud. Now, how did we accomplish this? We dedicated ourselves pretty early in the process to say we were going to vaccinate as many individuals as we can. When we talked to the governor's office, we said, hey, get us the vaccine and we'll make sure we got the resources to get those into individuals' arms. Now, to accomplish that, we have had to repurpose our staff. So that means our staff members that have been doing primary health care and seeing patients and taking care of their daily needs, we have repurposed a good portion of those to do vaccinations. So the downside to that is not as many people are getting primary health care, but we are vaccinating more individuals, which we totally believe that's the right thing to do and to save individuals' lives. So that's what community health centers are doing to make sure we can vaccinate that. We are making a concerted effort to vaccinate individuals over 70 years of age. At Salud, we have 5,000 patients that are in that category. We're working with other local agencies, letting them know that provide services to the over 70 age population, to let them know what we're doing and that we have vaccine clinics available to the staff members they serve. So that's going really well. We're working with local television and radio stations to get the word out that we have our vaccine clinics, and not just the normal TV and radio stations, also ones that tailor to the underserved population basis in the state of Colorado. So that's fantastic that's happening. As I mentioned, of the 4,480 we have vaccinated, 2,861 of those individuals are 70 to 80 years of age. 643 are 81 to 91, and 60 of them are 92 years of old. So of all the vaccines we've done, 80% have been over individuals that are 70 years of age. So we're continuing to focus on that population base. So this week, in our system, we have enough vaccine at most of our sites to go through Wednesday, and then our allocation ends for this week, except in the community of Aurora, where we are going to be partnering with UCHealth, like Dr. Zane mentioned, on a clinic that we're going to be running on Thursday and Friday of this week. We'll have the capacity there to do 500 individuals over those 2 days. We'll run the clinic from noon till 6 o'clock on those 2 days, and we're really looking forward to it. Salud is responsible for doing the outreach and getting the individuals' names, and then we are going to get that over to UCHealth. They'll do the scheduling and actually do the administration of the vaccine. And this relationship has come with, Salud's relationship with the CU School of Medicine, hooked us up with UCHealth, and that's how this came about. And we've also been partnering with Aurora Public Schools to provide us space and to help us out with getting the word out on the vaccination clinic. So it's a great model of how healthcare systems can work together to get our community members vaccinated. What I'd like to emphasize is individuals do have to pre-register for the vaccine, and we do have our flyer out that we are sending out to the community on how to register. And you can also, the community can also go to saludclinic.org to register. And please register in advance. They're not walk-up clinics, because as you can understand, the volume of individuals that want to get vaccinated is huge. And please use our website. Our phone systems are getting overwhelmed with the number of calls, and quite frankly, we don't have the capacity to handle that on our phone system. So it'd be great if you would use our website. I'd like to thank, the governor's office, the Colorado Department of Public Health and Environment, all the healthcare workers, my colleagues at other community health centers in the state, and specifically the Salud family health members, staff members, through their stepping up, their outstanding effort and commitments to combating this disease. So we're going to continue to be there for the state of Colorado and look forward to helping out any way we can. So thank you very much.
And John, thank you for the partnership. We are focused on fair and equitable distribution. That means geographic. It means by income, by race, all of the different factors. We want to make sure we can serve everybody over 70, and then obviously as we expand that, continue that commitment to make sure that no matter where you live or who you are, you have access to the life-saving vaccine. We have many other service providers as well. I want to give a few examples. Denver Health in Denver, working to contact and make appointments with people they've had contact with over 70 who've gotten care at Denver Health in the last 3 years. Banner Health has a location by location sign up in many different parts of our state that you can sign up to receive that. Kaiser Permanente, for Kaiser Permanente members 70 and up, you can visit kp.org/COVID vaccine to complete the sign up. Again, everybody over 70 won't get it in 1 week because we only get the 70,000 a week, and next week we will get that 23,000 more. They'll be used, but unless that quantity increases, it'll go all the way through February till everybody who wants it over age 70 can get it. Boulder Community Health is contacting folks over 70. They've also opened up a way to sign up, and they're opening that up as well. Vail Health. You can go online, Eagle County, make an appointment. SCL Health, very important, covers western part of our state, Grand Junction. They're contacting all of their patients 70 and up who are receiving health care. And again, that's many members of the community. People can also go to the website. You can find all of these at covid19.colorado.gov and then click on vaccine. There are many other provider partners in different parts of the state, so you can find one near where you live. We also every week have the ability to go into communities to do vaccination clinics. So we did San Luis and Center in the San Luis Valley. This last weekend, I want to highlight a vaccination clinic that we held at Zion Baptist Church in the Whittier neighborhood, predominantly African-American church. 150 congregants over the age of 70 were vaccinated and began their protection clock. And I want to thank Reverend Davis from Zion, the Ministerial Alliance, to helping to make this event possible to save lives. We'll continue to identify locations like Zion Baptist Church around the state where Coloradans who might not otherwise have access through community health clinics or hospitals can get the vaccine. The vaccine is free to receive. If somebody tries to charge you, that might very well be a scam. This is administered to you free of charge. With the new year underway, and more vaccines being administered and the hope of more vaccines being delivered to our state, there's a lot to look forward to. Saving lives, ending the pandemic. And yet it's also important to highlight the degree of danger that still faces Coloradans in their everyday lives. Right now, 1 in 105 Coloradans are contagious with coronavirus. That's why it's dangerous to have groups of people get together. If a group of 10 people get together, there's a 1 in 10 chance that somebody in that group is contagious, and it'll spread from 1 people to 7 people. Each of those people might take it back to their home, and you might have 50 cases coming from 1 case simply because 10 people got together to celebrate a birthday or a friendship, which we'll be able to do again in just a few short months, but still has a high degree of danger associated with it now. So let's continue to wear masks whenever you're around others in public, stay at least 6 feet away from others when possible, and avoid social interactions with people outside your home. If we can do that in this race against the clock, we will vaccinate the most vulnerable, end the pandemic, and allow us to return to our normal lives as soon as possible. Let's be safe, Colorado, and I'm happy to take some questions.
Governor Steve Stager from 9 News. Today, the CDC sent some updated guidance based on science suggesting people 65 and older should be moved up in priority for the vaccine. My first question, will the state consider updating the priority level again to fit that guidance? And secondly, You had mentioned the slow rollout of the federal pharmacy program for long-term care facilities. Could the state step in and take over this program if it's not meeting the demands? And at what point do you consider doing something like that?
Yes. So I'm thrilled with the guidance as an American because I think the problem in many states, not ours and not others that adopted 75 and up or 70 up, is they had an insufficient pool of people that were eligible for vaccinations. And that created a clog in the system that delayed vaccines from being administered. One of the reasons Colorado is one of the top states in the nation for successful administration of the vaccine is we had a sufficient pool of people, over 500,000 people over the age of 70, plenty of people. Other states that were overly restrictive did not have that. First of all, we do want to prioritize those who are most vulnerable. And there is a difference between a 60-year-old, a 70-year-old, an 80-year-old. People that are 80 plus who encounter COVID-19 have an 8.2% chance of dying. People who are 75 to 79 have a 3.2% chance, 70 to 74, 1.7% chance of dying, 65 to 69, 1% chance of dying. Contrast that to a healthy young person in their 20s. It's no fun to get, but it's a 0.01% chance of dying, right? So not fun, get sick, we'll lose some people. Tragically, at any age, it's a tragedy, but you have a 500 times greater risk factor for people in their 70s and 80s. So we have a good pool of over 500,000 people. We, of course, will be adopting our guidance. We'll be announcing that in a few days. It'll take place in a few weeks because we don't want to squeeze out an 82-year-old for a 66-year-old. That just, again, 8.2% chance of dying over 80, 1% chance of dying 65, eight times greater chance of fatality. These are based on a meta-statistical analysis by age group that was done. We see similar, not identical data in Colorado, but this is the meta-analysis of all the data from international sources. So we will be updating that. We'll announce a date that people 65 and up will be eligible. I expect that date will be in a couple weeks. In the meantime, we want to focus on 70 and up, and even within that group, of course, people in their 80s and 90s. We do have the ability, if we need to effectively supersede and take over distribution at nursing homes and long-term living facilities. The federal contractor would still be paid by the federal government. At that point, it would be a waste of federal taxpayer money, but our priority is getting it done. And so that, if you will, is a tacit leverage that we have to try to advance these. I think the more likely route is what we've taken, which is saying, what do you need to get it done quicker? CVS and Walgreens. We'll help. We're there. Do you need coordination? Do you need nurses? What do you need? But at the end of the day, if they can't meet a time frame that is aggressive to inoculate everybody who lives or works in a nursing home or senior facility, the state will have to step in and, working with those centers themselves, get them the vaccine and establish vaccination programs. And we're actively considering augmenting their ability to move their time frame up by a week or two.
Hi, Governor. This is Joe Vaccarelli with Denver 7. Have there been any discussions, or are there any plans to open up more large-scale vaccination sites like we had with testing at like Ball Arena, Coors Field, Power Field? We see they're doing this in Los Angeles at Dodger Stadium. I mean, have we had any of those discussions here in Colorado?
So UCHealth on this call today talked about a mid to large scale vaccination facility that they're doing. But we also know that people who are receiving vaccines value convenience and some degree of intimacy. They don't particularly want to spend 6 hours in a car line to get a vaccine. So there's a role for all of the above, but a lot of the economies of scale that we recognize with vaccine distribution occur in the 500 to 1,000 a day range. There's not a lot more efficiency you get at 10,000 a day than 1,000 a day. Maybe you pick up a little, but a lot of those benefits are really going from a place that might do 50 a day to do 500 a day. So that's the sweet spot, and that allows us to have a greater geographic diversity of serving people, more orderly traffic flow, scheduled. But I think you'll see some of the large scale, but I think most people will do small and medium scale for the vaccine because there's not a lot of operational efficiency gains between 1,000 a day and 10,000 a day. To translate that, we think it's generally more convenient to have 10 sites that do 1,000 a day than one that do 10,000 a day in terms of people accessing the vaccine, but you'll see some of all of the above.
Hi, Governor. It's Jessica with the Denver Post. Among the changes that we've seen from the federal government today is that they're changing how they allocate vaccine doses to the state. It's no longer going to be based on per capita. So is Colorado expecting to have changes on how much vaccine it gets each week?
So I have a call after this with the vice president and the current administration. We have another call with Western governors with the Biden administration on COVID. I feel a lot more comfortable getting back to you after we know more of those answers later in the day. So we'll be happy to get back to you around 3 or 4 in the afternoon if that works for you.
Yes, it does.
Hi, Governor. This is Seth of the Gazette. Excuse me. 2 questions for you. One, curious if you saw the town of Monument, which said some of the COVID restrictions are unconstitutional. Curious if there's any sort of fines, punishment, any action the state can take to ensure they're enforcing some of those state orders. And second, sort of off topic, but are you kind of planning any response or added security to the Capitol this weekend? And have you had any discussions about the National Guard being included in that? Thank you.
So first of all, we of course have successfully faced a number of challenges on the health restrictions that counties of the state have put in place. The only one that we lost was one around the right to petition and put things on the ballot, and that was overturned. But everything else has been sustained by the courts. So they're simply incorrect if they say it's unconstitutional. The courts have not agreed with that. These extraordinary steps have saved the lives of thousands of Coloradans, and we have sought from the beginning to balance the need for economic activity, the need for social and emotional fulfillment, with the need to save lives, prevent agony and loss. We have done that in Colorado. We have one of the strongest economies in the nation, a lower unemployment rate than the national average. We also have a lower than average number of deaths per capita than the nation as a whole. So no one's perfect, but really Coloradans deserve a lot of the credit for stepping up, because much of what has needed to be done is not a matter of a city taking an action or a county or the state. It's just individuals making the right choices in their own personal behavior. No city or state is going to tell you you can't socialize with others. We may advise that, but it's really up to you. Just don't socialize with others. Don't throw parties, wear a mask. You will see that life you save might very well be your own life. I have been briefed by the State Patrol. We are prepared to address any threats. We're monitoring the security situation, working with our federal partners as well. And we look forward to doing everything we can to protect our Constitution and protect the state of Colorado.
Hello, Governor. This is Vinny Delchulis at Bloomberg News in Denver. I take it you're going to move with the CDC guidelines about 65. Does Colorado have the infrastructure in place to handle a likely surge in demand given the new guidelines from the CDC? Thank you, Governor.
Well, it's not a major change for us because we're already doing 70 and up. We would be adding 65 to 69. So running the numbers, that'll add, could be 20, 30% to that group. But there's more people 70 and up than there are in that 5-year age range. We will be making an announcement on that in the coming days, and that announcement will include the start date for 65 and up, which will be in the next few weeks.
Hi, Governor. It's John Engold with the Colorado Sun. Thank you for taking my question. Again, focusing on the new CDC guidance, it also appears that there will be greater priority for adults of any age with underlying medical conditions. I'm wondering again if you're going to move those individuals up, and then what does this mean for others who are in the priority line, teachers, for instance, grocery workers?
Yeah, let me give Dr. Zane an opportunity to comment on this from the medical perspective, but from the data that we're seeing, the greatest inherent risk factor is actually age itself. No question that comorbidities and pre-existing conditions contribute at any particular age range, but we are seeing risk associated with age itself. And I want Dr. Zane to comment on that from a clinical perspective, and then I'll go back to your question. Dr. Zane?
Yeah, so that's a really great question. And when we think about risk factors and comorbidities, we think about them as impact and confounding variables. So how important are they? And what we know is that age over 75, age over 70 is a single important confounding variable that is greater than any of the comorbidities. So it's really predominant and dominant. So it makes sense medically that we would vaccinate people over 70 first, and then think about comorbidities. And once we think about comorbidities as equivalent, meaning if we were to vaccinate 45 to 50-year-olds, then we would think about comorbidities. But for right now, age is the single most important confounding variable.
And I would just assure folks, we have a very data-driven process about saving lives, goal, ending the pandemic. And we want everybody to be able to receive this vaccine as soon as possible. But it's very important that those who receive it first and earliest can reduce the number of deaths and hospitalizations as well.
Hi, Governor Polis. It's Andrea Dukakis from Colorado Public Radio. Right now, Colorado has a lot more inventory of the vaccine on hand than it's administered. And Brigadier General Sherman told me last week it was part of the problem was getting the infrastructure up and running, and that would change this week. But according to the CDC, it looks like about 45% of the inventory we have received hasn't been used. And you can't really attribute a lot of it to the federal partnership. So I'm just wondering why that's, sitting there and not being used at this point, and how you can ramp up if there's already vaccine not being used.
So we're happy to get you specifics on that. I don't think that the data you have is correct. We aim to use every dose every week. Now, what that means is on Monday and Tuesday when we receive it, there will be more unused, and that gets used by Sunday of the following week. So if you're looking at Monday or Tuesday data, you might show some unused doses. If you're looking at Sunday data, it should be very close to zero. There might be some Monday clinics. So we'll be happy to, Olympia, after this call, I can have General Sherman or Rick Palacio give you those numbers, but we expect to carry over no inventory from week to week. There could be minimal inventory if they're Monday and Tuesday clinics and they're unsure of supply for that week.
Hi, Governor Polis. This is Lori Lizarraga with 9 News. I have 2 questions. The first, I think, is for Dr. Zane. Dr. Zane, you mentioned 600 non-patient invitations have been sent. How are those invitations being sent, through what medium, and how are you securing that contact information? And then my second, Governor Polis, is for you. We heard UCHealth mention that they're setting up a call center. Salud even said they can't handle the number of calls they're getting into their clinics. So is there a plan for a call line at the state level to schedule vaccines?
Dr. Zane, do you want to take the first one?
Sure. So if you go to our website, uchealth.org, and click on the COVID-19 button, it'll take you to the option to register for the vaccine. So it creates an account for you, which then gives us access to you and how to connect with you. So you put in your name, date of birth, Colorado, and then contact information, and then we randomize you and send you invitations through the My Health Connection mechanism. You've essentially set up a UCHealth account when you've registered.
And the state would not be the entity that would set up the appointment. I think that answers your second question. People set up the appointment with where they're getting the vaccine. It could be UCHealth or Centura. It could be Safeway. It could be Community Health Clinic. We enter into proactive partnerships for the outreach side on equity, like we did in San Luis and Center and in a Denver church, but even those are not scheduled through us. So the scheduling is with the partner where you're getting the vaccine. We do have on our portal all of the different sites that we know of where you can get the vaccine and sign up for it. So that's covid19.colorado.gov. Click on vaccine. There's a list not just of the folks on the call today and the folks I mentioned. There are others in other parts of the state where people can set up an appointment to get the vaccine.
Governor Polis, this is Jacqueline Allen with Denver 7. We're hearing from people, this is not vaccine related, but very much pandemic related. We're hearing from a lot of people whose cars are being towed or booted in condos and apartments complexes because of expired registration. Now, your office has asked for leniency in this area, but we have found that it is not happening. So during this pandemic, when we are seeing delays at the DMV, would you consider placing restrictions on towing people because of expired plates?
This should not be happening in Colorado. First of all, we took action to ensure that people can register their cars online. They've been able to do that since April. And this is that you all make us aware of the very first complaint of predatory practices in towing that we've heard associated with COVID-19. There's always been predatory practices in towing, but this is the first one that's been brought to our attention during the pandemic. We're looking into it, including how we can solve it and prevent additional predatory towing cases. And we strongly discourage predatory practices, and consumers can file complaints with the PUC, and we take those very seriously. As you've exposed, this can be a racket. People have to pay hundreds of dollars just to get their car back. And it's inappropriate, and we'll take whatever steps are necessary to make sure it doesn't occur in Colorado. Any additional questions?
Hello, Governor. You hear me?
Yes, go ahead.
Okay, I'm Jesus Carrasquel from Noticias Univisión Colorado, Gobernador in Spanish. Si una persona mayor de 70 no tiene seguro médico y también es indocumentada, ¿podrá tener acceso a la vacuna del COVID-19 y qué debería hacer?
Todas las personas pueden vacunarse en nuestro estado sin importante estatus migratorio o seguro. Pueden ir a cualquier lugar para recibirlo gratis. I think there's two more questions. Go ahead.
Hello, this is Meg Wingeter from the you've said about wanting to make sure that no doses are wasted, but we heard last week that some some public agencies were saying they'd been threatened with having their access to future doses cut off if they vaccinated people who were in a lower priority group before finishing everybody in their in the higher priorities. So how does that square? Is it like, okay, you have an extra dose at the end of the day, you can give it to whoever you can get into the office, or is that not allowed either?
So you broke up a little bit there, but I think I got the gist of your question. We are prioritizing those at greatest risk from the virus in Colorado. Where I think some states have run into trouble is they've had too narrow a list in their prioritization categories, and that has delayed the administration of vaccine. We have well over 500,000 people, some of the medical workers still, and then people 70 and up, probably 700,000 people in the current categorization for vaccination. With that level, number of people, there should not be any dosage wasted. And it would be insincere to say you couldn't find somebody eligible when there's 700,000 people that are eligible. That's a big segment of our state population. So we expect that our providers are working to find people that are in those groups that are eligible and are consistent with the desire to save lives and the pandemic. Do any of our providers want to comment on that one?
So in order not to waste doses every single day, we know that exactly how many people are registered, how many vaccines we're going to deliver. And if there is someone who doesn't show up, or there's an odd number, meaning we have 4 or 5 extra doses in a vial, we have a pretty extensive on-call list for every single one of our clinics that includes patients over 70.
And of course, the medical personnel also eligible. There could be some that haven't had a chance to schedule it yet and could receive those as well. Final question.
Yes, this is Kelly Lyle with Fort Collins, Colorado. And do you ever, I understand vaccines are limited, the supply limited, but do you ever see a point where they will be able to be distributed so fast that there won't be a need for appointments, where you can literally line up hundreds or thousands of people and just give them the quick shot in the arm and move on.
Absolutely, and you won't even be lining up hundreds of people at that point. There will be a future date where this will be just like your flu shot. Your local pharmacy, your doctor's office, plenty of supply, no particular drama around getting it or scheduling appointments. It's hard to get exact visibility into when that date is, but I suspect it's fall of this year. But in the meantime, we are constrained by quantity. We are prioritizing those whose lives we're most likely to save, and also reduce hospitalization needs. That's why we have this data-driven manner of prioritization in our state. And for the next few months, it's likely to continue to be appointment-based, whether it's a large-scale clinic where there might be 5 or 10,000 people, but still with appointments, not just showing up and waiting. But eventually, this will be your local pharmacy, your local doctor's office, like the flu shot and like other shots.
Yeah, Governor, I would add, we're taking walk-ins now, and I'm sure all of our health system colleagues are. So if you don't have access to a computer or a phone, or can't fill out the paperwork online, you can walk in. We prefer appointments, but walk-ins are available. They're probably the exception rather than the norm right now.
Yeah, we don't want to create a expectation that everybody can walk in or you'll be deluged, but there's a few lucky walk-ins that get it, I guess is a good way of putting it, but that's not a good way to budget your time. You're just as likely not to get it, or perhaps more likely not to get it than to get it. So try to set one up ahead. You don't need internet access. For people who don't get email, they are reaching out on the phone as well, to be clear, to many customers 70 and up who just have telephones and not internet. A lot of the clinics are also walk-in. So there's some of all of those, but it's not walk-in to the point where, like, they have it, you can get it, you just show up when you want and get it. That we won't be there for some time. But yes, there are people that in our equity mission just aren't able to or haven't set up appointments, and some are getting them at the stand-up clinics and others. But that's a lower probability way of making sure that you have access to the dose you need, but it is occurring in our state, and it's certainly something that we celebrate and support. And to the extent we're able to do that, that also helps making sure we don't waste any doses and get them into arms promptly. Thank you, Peter, for bringing that up. So thank you all for joining us. Let's stay safe, Colorado. We talk a lot about the vaccine, but we are still in the throes of the pandemic. In the scheme of things, just over 3% of Coloradans have received their first dose, and many of those have just begun their protection clock. We're still at under 1% that have 95% protection. That is inconsequential in the scheme of the pandemic. We are still in the throes of the pandemic, national surge, most cases, most hospitalizations. We need to do our best to avoid that fate here in Colorado by avoiding socializing with people outside of our home, wearing a mask around others, and keeping 6 feet of distance whenever possible. Thank you to our provider partners, and thank you to everybody for staying safe.